It's time to check in with Infectious Disease Specialist Dr. Zain Chagla with the latest developments in the pandemic. Good morning. Happy Friday. Good to see you.
Happy Friday, Bob.
So the latest development we have this morning from NACI that the mRNA vaccines, Pfizer, Moderna, are the recommended vaccines.
Yeah, I know people are frustrated. This keeps changing every about 10 minutes. This is based on the recognition that the clotting risk still remains with the second dose of AstraZeneca, although not very high. But also the fact that we have a lot of mRNA vaccines, and the data suggests with upcoming variants like Delta, mRNA vaccines may have an advantage. And recognizing that actually, emerging data about mixing vaccines, particularly an AstraZeneca vaccine followed by a mRNA vaccine, may give you higher antibody levels than even 2 doses of mRNA vaccine. So, I think the balance of all these pieces is, if you have the option right now, get an mRNA vaccine as your second dose. If you've gotten your AstraZeneca vaccine, it's not the end of the world. You will still have significant protection, 60% against Delta, 92% against hospitalization. And certainly in England, the people being represented in hospital are people that are unvaccinated. But if you have the choice right now, the best step and probably the easiest step is to get a second dose of mRNA vaccine.
Right, and it does eliminate that very low threat of blood clots.
Yeah, absolutely. There's zero threat of blood clots with an mRNA vaccine versus 1 in 600,000 with AstraZeneca.
Right. Now, AstraZeneca is not approved in the U.S., so let's talk about Canadians with the AstraZeneca vaccine who want to travel.
Yeah, I mean, number one, this is probably the second most common vaccine given in the world. So, I think you can't really hide it under the rug that people will need to travel with an AstraZeneca vaccine. It's interesting. The United States didn't approve the AstraZeneca vaccine, but it wasn't necessarily for the fact that it wasn't considered an efficacious vaccine. It is an incredibly effective vaccine. It was because at the time of approval, the blood clotting issue started. There was a vast supply of mRNA vaccine and the Johnson vaccine, and so there wasn't really a position in the market to actually bring it there. Is that a reason to discriminate against people that got the AstraZeneca vaccine? No, absolutely not. Their protection is probably the same as other vaccines out there. And I think there is a big discussion now amongst world leaders about how to actually validate that vaccines are effective. There are other people around the world that didn't even have access to AstraZeneca, Pfizer, Moderna, or Johnson, where their vaccine is World Health Organization recommended, but still not approved in other places. So, I think that the Bruce Springsteen thing starts a larger discussion around what to do about fully vaccinated people who don't have an approved vaccine by that government. And we do need some recognition that that's still reasonable for people in that context.
Yeah, because people have a lot of Broadway plans and other plans. So, yeah, it's something to consider. Now, with the vaccine rollout here, we have some region hopping, and that's impacting the hot spots where people who really need it aren't getting it. They're getting bumped out of appointments.
Yeah, I mean, it's not going to be elegant, right? The one thing here is the approach by public health in Ontario isn't necessarily diverting doses to regions, at the expense of other regions. It's filling up their fridges faster. So, at the end of the day, if regions have the capacity to deliver vaccines, especially in the Delta hotspots, public health in Ontario will dump more vaccines in their freezers to get more vaccines out there. So the region hopping, yes, it's an issue. Pharmacies aren't necessarily regulating by region, but at the end of the day, people will get their second doses of vaccine one way or another. And whatever models work, we know that people live in complex environments where they live in one place, work in another. Again, as long as the freezers are getting filled and a lot of vaccine that's coming over the next 5 weeks gets people their second doses, I think some of this is acceptable. And again, the end goal is getting people fully vaccinated one way or another.
Yeah, and it is a race against that Delta variant. Are you confident that we're ahead of it? And Waterloo is emerged as a hotspot. What's behind those numbers?
Yeah, even Hamilton is now declared a hotspot. I think we're starting to see transmission. This is a more transmissible variant. The data from the United Kingdom today suggests maybe 40 to 60% more than Alpha or B117. There are populations where there's still vulnerabilities, right? In Waterloo region, there is a large homeless shelter outbreak that is ongoing and up to 87 people as of yesterday. And again, places like this are where this variant is going to emerge, where there's poor ventilation, poor spacing, poor
Right.
vaccine rates.
Yeah.
And unfortunately, part of our effort is going to be targeting these folks, for sure.
I wish we had more time. And of course, the rollout and everything has been messy, but as you have written, it's a miracle that we're at where we're at today.
Exactly.
And I'm sure the news will be better yet when we talk next week. Dr. Zain Chagla, good to see you.